Hi everyone, this is Dr. Pulkit. I'm an ophthalmologist working with the NHS, and via these presentations, I shall endeavor to answer some of the most burning questions you have regarding your eye, the conditions you suffer from, some surgeries and lasers. In this first episode, we will be dealing with the most common condition which draws you towards the eye clinic, and that is cataract. Very often I've heard my patients or their relatives and attendants expressing their concern or anxiety when they are told that they need cataract surgery. So I need a cataract surgery, and frankly I'm worried about it. And actually there's not as much to worry about as we make of it. But let's start with the most burning or the most common question: why or how did this happen to me? Please understand that cataract per se is not a disease. It's just an age-related degenerative condition or a process. Like as you age, you develop wrinkles over your skin. Because of degeneration, your hair turns white or it falls off. So it is just something which will happen to everyone sooner or later, and it is quite common. In fact, the literary definition says that cataract, when it develops after the age of 40, is to be expected. It's called a senile cataract. So, though it develops or it comes to everyone, some people might develop it in much later stages of their life, while some early. And a common question that I'm confronted with is, can you tell me how soon or how slowly it will progress? So that is something which is almost impossible to predict. Sometimes people reach the 9th decade of their life without quite a significant cataract and are able to manage quite well, while others might start having problems early on. And until now, the only management for cataract is a surgical correction. There is no medical treatment available for this particular condition. Now, when I said that the senile cataract or the common one develops after the age of 40, most commonly it's the 6th decade or the 7th decade where most of the people are affected by it. But in certain people who have birth defects, congenital conditions, or injuries to the eye, excessive inflammation, long-term associated disorders, chemotherapy, immune therapy might develop this condition earlier than the others. Also, some factors which are associated with the progression of cataract are like diabetes, smoking, excessive ultraviolet exposure. Diabetes is definitely a factor which causes change in the lens curvature, and also accumulation of water inside the lens, which causes cataract development. So, what is cataract actually? Cataract, very commonly known, but it comes from a Latin term cataracta, which was used to describe the white color of the waterfall or a floodgate. So basically, when the gate opens and the water gushes out, or you must have seen pictures or in real life, the white foamy color of the waterfall is what the ancients observed in the eyes of an affected person. They turn white, and that's how the name cataract came up. But nowadays, generally, with early intervention, we do not wait for cataract to reach that stage where it becomes dense pearly white, and we intervene earlier. So what is exactly cataract? If you can, those of you who are listening to the podcast, I'll describe for them, but those of you who are looking at the YouTube video might see a picture on the right side of your screen. That is a section of the eyeball, if the eyeball is cut along its length. So the front surface or the outermost part of the eye is called the cornea, and it is the major structure which causes bending of the rays of light as they enter inside the eye. We'll be discussing about cornea in detail and some associated disorders which affect you in our subsequent videos. And the back part, where the nerve is emerging out of the eye, that is where the retina is, or the nerve layer on which the rays of light fall and the image is formed. But at present we are concerned about the structure which is in between these two, not exactly in the center, but behind the cornea, that is the spindle-shaped structure which is called the lens, or the natural human crystalline lens. There's a red arrow pointing towards this lens. Now this is the structure from which the rays of light pass and enter the eye, and it helps us see. And this is the structure which is normally transparent and clear, but as time progresses or because of other factors, it starts losing its transparency. So when it is not clear or transparent anymore, that is the condition which is exactly called as cataract. Now our lens contributes to about 1/3 of the refractive power of the eye. That means the rays of light, when they bend to enter the eye, out of that entire power, 1/3 is contributed by the lens. And another important feature is that the lens alters its shape. It becomes more swollen or more contracted to help us focus and refocus from distance to near. We can look at distant objects and we can also look at near, or while we are reading, the lens becomes more convex or thicker. Obviously that capability or capacity reduces as we age. Another different thing which we'll be discussing in further subsequent episodes, for which we need reading glasses, generally also after the age of 40. So it is this spindle-shaped structure, clear structure, which when it is not clear anymore, that condition is called cataract. So imagine that you're looking outside your window, a clear plate glass window, and you're admiring the view, and then the window becomes dirty. So everything on the other side becomes foggy and dirty, and that is exactly what the cataract does. So basically it obstructs your view and it causes deterioration of the quality of vision. Also, in the early stages, it swells up a bit, makes you a bit more short-sighted than you usually were. So eventually causing blurring of vision. And this needs to be corrected, and at present the best way of correcting it is a very swift and painless surgery, the cataract surgery, which has evolved over these past decades. So obviously if you're told you have to go for surgery, you won't want to go for it immediately. What if you don't, the patient asks me, what if I don't want to go for the cataract surgery? So if you don't go for the surgery at the time which is right, obviously the cataract will become more and more dense. The lens will become thickened. It will become more opaque. Your visual quality would get affected, especially if one eye is affected more than the other. Please note that cataract is an age-related condition. Both the eyes are affected, but it is always asymmetrical. It is very rarely found that both the eyes have equally dense cataract. Always one eye has a more dense cataract than the other. So if you are managing quite well with the other eye, you would not be very keen to go ahead with the surgery. But as the lens becomes more dense or loses its transparency, it starts causing other complications in the eye. The lens swells up, it starts closing the channels inside the eye. That might cause rise in pressure inside your eye, like the blood pressure in your blood vessels. There's also pressure maintained in the eye, and if that pressure goes too high, it starts damaging your optic nerve, causing something called as glaucoma. Also, the structure of the lens might get ruptured if it becomes too thick, causing inflammation in the eye. So secondary conditions like glaucoma, uveitis, obviously your vision is affected. If one eye is affected more than the other, if both are affected, you practically start becoming blind. And if you do decide to go ahead with the cataract surgery at later stages, when the lens has become very dense, then the surgeries are definitely more complex, they are time consuming, and there's a very high risk of associated complications. Also, you might not get as good results as you might get if you go for it at an early stage. Obviously, blindness, as we said, if both the eyes are affected by cataract or secondary complications occur, you might end up losing your eye. And the World Health Organization does recognize cataract as the most common preventable cause for blindness in the world. So now when is the right time? Is it the right time when my doctor tells me to go ahead and get the cataract surgery? I mean, obviously you are sometimes skeptical and doubtful about the intentions. There might be some commercial aspects of the practice. So yes, but sometimes there are some other factors, other coercing factors, which have to be tackled by doing a cataract surgery, not just the vision, but as I said, pressure inside the eye, the spaces inside the eye. So if your doctor is advising you to go ahead with the cataract surgery, it might be a good idea. Another rule of thumb is that if your day-to-day activities are becoming difficult, like driving, watching TV, reading, if these are starting to get affected, the quality of your life is starting to get affected, it's a good idea to go ahead with the cataract surgery. So generally, most commonly, one eye is operated first, with whichever eye has a more denser cataract. And if both the eyes have cataract, then the other eye follows. Rarely now, however, some surgeons are also starting to do something called BSCS, the bilateral simultaneous cataract surgery, where both eyes are operated in the same sitting, so that patient doesn't have to come again and again, financial and logistical factors as well. Another question which is quite commonly posed is, can't I just get stronger glasses? Maybe I should just visit my optician once again. Maybe I can get stronger glasses and just delay or postpone the surgery. So I want you to understand that glasses, basically, what they do is they change the point or the focus on where the rays of light are focusing inside your eye. Suppose the front part of your eye, the cornea, is more curved or less curved than usual, then you either add to it by wearing plus lenses or take away from its curvature by using minus lenses. And basically you're changing the position where the image is forming inside your eye or on the retina or on the nerve part of the eye. But suppose in early stages, if the lens is just getting swollen and the ray of light is getting shifted in front, you're getting short-sighted. That time, lenses might help you, stronger glasses might help you. But in case, like I showed you, if the window has become dirty, then you might not be able to get much help with new glasses, because if the rays of light are not able to enter the eye at all, what will the lenses do? They might not be able to shift the rays of light or shift the image unless they can actually enter. Another thing is that the eye doctors use that lens and that pupil, the small hole or aperture in the center, to look at the structures on the back part of your eye, the retina. So because you cannot see clearly through a dirty lens or a cataractous lens, your eye doctor will also not be able to see at the back of your eye properly. So it is obviously and always advisable, if you do have cataract, to go ahead with the surgery, improve your quality of life. When you go to the doctor's appointment to talk about this, you should always, anyways, to any eye appointment, should always carry a current and updated spectacle prescription if you are using those. If you're not using for distance, at least for reading, it's always a good idea just to click a picture on your phone. Now it's very convenient. You don't have to carry a bunch of papers with you. And you should also discuss your goals after the cataract surgery, your vision goals with your doctor properly. This will be affected by your vision, by your profession or your interests. Suppose you do very minute, delicate, precise work, you have to look very closely. You're a tailor, you're a weaver, you're a painter or artist, or you're an author, you're a writer. So all different professions have different requirements. Almost all of us nowadays use a lot of screens, our phones, our laptops, our tablets, iPads, whatever. So the intermediate part of our vision is also under a lot of strain. So you should have an open discussion as to, because in the cataract surgery, your natural lens will be replaced with an artificial lens, and that will improve your vision. And this artificial lens will have a certain power which will be calculated, and that power will give you a certain amount of vision for distance or for reading. So what does the surgery involve? Most procedures, most cataract surgeries, majority of them are done under local or topical anesthesia. Topical anesthesia means they just put some numbing drops or anesthetic eye drops into your eye, and you are able to get the surgery without any further invasive needles. Obviously, you need to be quite cooperative to get this type of surgery done. And if you feel that you tend towards anxiety, and you might not be able to stay stable, or you might move during the surgery, it's always a good idea to go one step further and get a local anesthesia. Earlier, this was given by needles, around the eye, injections around the eye. Now most of the health and care systems in the world have converted to a different kind of anesthesia, where a blunt tube is used to give the anesthetic around the eye so that it becomes numb, the movements are also restricted, and you comfortably get the surgery done. You might have to lie down, you will have to lie down flat on your back to get the surgery done, and the average time is around between 10 and 40 minutes. Obviously, this can be shorter depending on the experience of your surgeon, or if some complications are faced during the surgery, it might be longer as well. But that is just the average. About 20 minutes is the time when most of the people are able to get the surgery and leave. It's the paperwork, the preparation, the anesthesia, all those things which take actually longer than this procedure itself. As for the aftercare after the surgery is done, depends from surgeon to surgeon. Some surgeons do not give any pad or bandage to their patient because it's a micro-incision cataract surgery, which is most of the times practiced, while some would prefer to give you a small shield or a bandage over the eye so that you might not poke your eye during that night accidentally. And obviously you'll have to use some eye drops over the course of the next 4 weeks just to make sure that the eye doesn't get infected. And obviously, though it is a controlled trauma, it is still a trauma to the eye, so the eye doesn't get inflamed either. Those of you watching the video can see that's the tiny artificial lens that is implanted. It can be between 5.25 millimeters to 6.5 millimeters in diameter. That is implanted inside the eye. But basically, it's not the laser that is actually used to do the surgery. It's a titanium probe, a very tiny titanium probe, which uses ultrasonic energy that is generated by something called as a piezoelectric effect. Piezoelectric effect is something which is used in your gas lighters at home. So that effect causes the titanium tip to vibrate very rapidly, and it crushes the material inside the lens, removes it, and then you can get the artificial lens implanted. All this is done by a tiny 3 millimeter wide incision. So most of the times no stitches are required absolutely. And even if they are required sometimes, it depends on the surgeon's discretion on the table while operating. If they might feel that there's a certain risk involved, they might put a single stitch or two, and they are all absorbable. And the artificial lens is safely ensconced or safely positioned inside the eye. You cannot see it from outside. A professional might be able to see, and it obviously never pops out or anything. It doesn't get removed. It's safely inside the eye. So when you decide to go ahead with the cataract surgery, there's a pre-operative assessment and there's some information which is required. And most of the times we are very forthcoming with all the information. So do tell your doctor about any and all previous as well as current medical conditions you are suffering from. It might not seem relevant to you because you think you're getting an eye surgery, but it is extremely important for your doctor to know what drugs you are using, what conditions you suffer from, because the eye is the mirror of the body. Every little thing in the body also affects the eye in a direct or an indirect way. And especially diabetes, a very common lifestyle condition. If you suffer from that, or you use insulin, or whether you use tablets, you should make your doctor aware about it, because diabetes is very commonly associated with changes at the back of the eye or the retina. We'll again talk about these during subsequent episodes. And these changes might affect the outcome of the surgery. Also, another condition which is being seen for some time is age-related macular degeneration, which causes destruction of nerve cells at the back of the eye because of degeneration. Again, if you have that, that will affect the outcome of the surgery. So a complete information to the doctor is essential. Also tell your doctor about all the allergies that you suffer from. Not only drug allergies, but allergies to other materials like, for example, latex or rubber or iodine, because all these things would be used during your surgery. And if you are prone to have a reaction, it should be known well in advance. As I said, you will be expected to lie down flat on your back for about 30 minutes. So if you have any posture related problems, neck or back problems, or breathing difficulties, any apnea while you lie down, just tell them, and a lot of reasonable adjustments can be made to the trolley. Sometimes the doctor might advise for you to have a trolley trial where they simulate the conditions of a theater and you lie down on the trolley and see if you will be able to cope with the time while you're lying down. If all else fails and we are not able to assume the correct position, then you can have the surgery done under general anesthesia where you are put to sleep and can comfortably get the surgery done. Along with that, also, please tell your doctor if you have had any previous surgeries, not only to the eye, anywhere else in the body, or any lasers done to the eye as well. We'll talk about the lasers in a couple of minutes. Or if you had any adverse reactions to anesthesia in the past. All this would be vital information. It will ultimately affect you more than it affects anyone. So please don't withhold anything. Sometimes you might forget. So it's always a good idea to tell your doctor, even if it is on the actual day of the surgery itself. Then after the cataract surgery, once it is done, your question would be, okay, I was using glasses or I wasn't using glasses or just reading glasses, but will I still need glasses after the surgery? After all, I'm getting an artificial lens implanted in my eye. Will I need glasses? So the answer is that the most commonly performed procedure or the most commonly implanted lens with repeatable and good results are when doctors aim for correcting your vision for distance, something which is called as emmetropic correction. The natural lens, as you might remember, I told you, it changes its curvature so that you can focus between distance and near. Our artificial lenses, however, do not have that capability. Not entirely true. Let's get back to that in a minute. But for the sake of argument, let's say that our artificial lenses do not have the capability to adjust between the distance and the near. So what do we do then? You can either get your vision corrected for the distance or you can either get it corrected for near. And most of the people opt to get their vision corrected for the distance because that is the vision they will be using for driving, for watching TV, for all regular activities. And since after 40 they're already using reading glasses, they don't mind using glasses for reading. So with this type of correction, it will be aimed that your distant vision is perfect. You might need a little bit of correction or a minor lens with that, but you will definitely be needing reading glasses. Still, if you absolutely do not want to use reading glasses, if you want a surgery which corrects your distance as well as near vision, there are two options generally which are available, which are at your disposal, and these are called as multifocal lenses or monovision. So what are multifocal lenses? Multifocal lens, as the name suggests, theoretically, this is a lens which has multiple rings inside it. It's an artificial lens which will be put inside your eye, and it has the capability for correcting your vision for distance, for near, that is for reading, and also for the intermediate part which we use for while we work on our screens, laptops and all. So theoretically, as I said, these lenses can correct the vision to a certain extent, but since they are relatively recent, long-term results of these surgeries are not available, and even if they are available, they have not been very, very satisfactory. Generally, most of the surgeons agree that some of their patients after the surgery had to go for an IOL exchange, that means intraocular lens exchange. They were not able to tolerate a multifocal lens because of its rings. It sometimes causes a lot of diffraction or scattering of rays of light, especially in the evenings. If you're driving and your pupil is a bit dilated, it's a bit dark or dim, there might be a lot of scattering of light and discomfort. But obviously, very few surgeons might offer you this, but do your research properly, and if you do want to go ahead with a multifocal lens, have an open and a detailed discussion with your doctor about all the pros and cons. And if you are indeed a good candidate, they might go ahead with the surgery and you might get good results. But especially people who have very precise near work or delicate work, as I said in the past, or they are themselves surgeons, multifocal lenses are not very advisable because they have a spectrum of vision, but they will not give excellent clarity for both distance as well as near. The other option, which is more readily available, is monovision. Monovision is as you have two eyes and both the eyes have to get operated one after the other for cataracts. Sometimes what people opt is that they opt for one of their eye to be corrected for distance and the other eye to be corrected for near. And generally it is the dominant eye which is corrected for distance. Now, some of you might be aware, some of you might be surprised to know like some of us are right-handed, the others are left-handed. That means the right hand is dominant in some of us and the left one in others. Since birth, one eye is more dominant than other in all the human beings. Some people are quite aware of this fact, some people are not. There's a very simple test to find out which of your eye is dominant. And if you do opt for monovision, your doctor will be putting the lens to correct the distance for your dominant eye. That means they will put an artificial lens in your eye so that suppose your right eye is dominant. In that case, your right eye will see clearly for the distance. And when the time comes for your left eye to get operated, they will put a lens in your left eye so that your left eye can manage the reading part without using glasses. So in that case, it theoretically is the best of both worlds. You will be able to see to manage for distance with your dominant eye, and your other eye you will use for reading and stuff. But sometimes it becomes very difficult to adjust to this difference or asymmetry between the two eyes. It might make your life difficult. And the solution to that is, if you are keen on trying this, but you are also wary of the result, you can have a contact lens trial. In a contact lens trial, the vision after the surgery will be simulated before the surgery. One lens would be put in your dominant eye, which will correct your vision for distance, and a lens in the other eye, which will correct it for near. And then you will be able to experience how your life will be after the surgery with one eye corrected for distance and the other for near. So you can have a discussion with your doctor about this. If you're a good candidate, you can go for monovision. And if, again, you do not have to do very minute work, you will be able to have a reasonably good result after the monovision cataract surgery. If you have been using lenses prior to your cataract surgery, that means you've been using glasses, especially if you are highly short-sighted or long-sighted, you've been using thick glasses in your lenses. What will happen after the cataract surgery of one eye is that suppose you were short-sighted and you were using thick lenses and you had the surgery for the right eye vision will get corrected for distance, but the left eye still has a refractive error, it still needs glasses. So that will cause an asymmetry or an imbalance between the two eyes. How to correct that is to get the surgery done for the other eye soon after the first eye is operated. So the gap between the two surgeries, normally most of the surgeons want at least a 4-week gap between operating the first and the second eye so as to provide adequate time for the first eye to heal. But in this case, the surgery is done quite quickly because this asymmetry or imbalance between the refractive power, or as you can say, the numbers of the two eyes, will cause discomfort. It might also cause doubling of vision and certain things. So in that case, your doctor will definitely advise you to have the other eye operated quicker than usual. And if they don't do that, you should prefer it that way. Now, another common question is that I did have a laser surgery done to my eyes in the past, and would it affect the result of my cataract surgery? So first of all, what type of laser you had done is important. If it was a laser done to the back of your eye, a retinal laser, you should make your doctor aware They will anyways do an examination of the back of your eye to check for any scars which might affect the result. But if you have had a laser done to get your glasses removed, which is called a keratorefractive or an excimer or a LASIK laser, basically you don't want to use glasses, you get this laser done. You should never withhold any information regarding that from your doctor. Please tell them when you had the laser done, and if you have the records of what type of glasses you used to wear before the laser was done, that is very useful as well. Now, this laser might seem unrelated to the cataract surgery you're about to get done, but since the incision or the place where the surgery is done is around the structure where the laser was done, it becomes very, very significant at certain times. Also, since you naturally had a different type of an eye, you were using glasses, and now an artificial lens will be implanted, it is imperative that we know that what type of glasses you were wearing so as to account for the margin of error. A very common practice used to be that whenever people were going ahead for a LASIK surgery in the past, a calculation was done as to what type of lens they would need during their cataract surgery. It is entirely possible that that test wasn't done for you, or you might have lost the records, so no need to worry. There are some new machines available which will calculate the exact amount of lens which shall be implanted in your eye. As any other procedure, cataract surgery might also have complications associated with it. When your doctor gets you to sign the consent form, or you have a preoperative assessment or a counseling session, everything will be discussed with you in details. You will be made aware of everything, of all the risks and benefits of the surgery. Briefly, I can tell you that 1 out of 100 people who get the cataract surgery done might require an additional procedure to implant the artificial lens in the eye, but they generally have good results. That is because the membrane or the layer on which the artificial lens is placed might break, but it's quite easily manageable. A more devastating complication of the cataract surgery is when the eye becomes infected and no treatment makes any difference and you ultimately end losing your eye. That happens in about 1 out of 5,000 people who get this surgery done. So it is definitely a risk. You should be aware of it. But otherwise, the cataract surgery, the modern surgery, is quite quick, painless, swift, with very good results. And keep a watch for our future episode on consenting process and the complications associated with cataract surgery. We'll be discussing these in details. For now, I don't want to scare you. Also, if you have any pre-existing conditions, suppose you have diabetic retinopathy, you have macular degeneration, you have a scar, you have a previous injury, you had a squint surgery, such conditions might affect the outcome of the surgery. So if you haven't had any ocular history, everything goes straight forward, you'll have excellent results. If you have had a problem, then your doctor will be informing you about the level of vision you might attain after the surgery. So there'll be a slight difference possibly to the surgical procedure and the level of the risk of complications for you there compared to others. But that is definitely not a reason not to go ahead with it. Now, talking about statistics or success rate, obviously differs from person to person, but in majority of people, cataract surgery is a quite successful and life-changing procedure. It is the most commonly performed surgical procedure in the world. The visual recovery can happen as soon as the very next day or within the first 4 to 6 weeks after the surgery. When you are using the medication, the eye heals, the inflammation settles down, your vision improves. And again, another statistic, over 95% of patients who have had this surgery will have a best corrected vision. That means after all the aids and everything, the best corrected vision will be equal to or better than 6/12 in the British system, or 20/40 in the American system. So that's quite a good result. This is notwithstanding the pre-existing illnesses in the eye. So quite an acceptable and good result. Definitely a good idea to get it corrected. So this brings us to the end of the episode. I hope all the information was helpful. I have tried to cover all and any aspects or all the questions which are posed to me in the clinic. But suppose if I might have forgotten about something, do make sure to post in the comment section and I will reply as soon as possible. Also, if you have certain requests related to specific eye disorders and you want an episode regarding that, do leave a comment and I will endeavor to comply at the earliest. Do subscribe to the channel and stay updated. We will be discussing about all and any eye related conditions. And if you need any case specific medical advice, there's an email down there where you can drop an email and you will be replied soon. Thank you so much for joining us, and we shall meet next time with our next episode. All the best.